come with me for a very real and non-glamorous day in my life as a hematologist and bone marrow transplant physician. I usually get up around 6, get ready really quickly, get dressed and head in for a short commute to work, trying to arrive around 7:30, so that I have plenty of time to pre-chart. Had a cute surprise on my desk this morning. It is Doctor's Week. Fit in some quick charting to prepare for the day, and then it is time to grab some snacks from the doctor's lounge, some breakfast. They certainly keep us well fed around here. And at 8 a.m. we start our tumor planning conference. Once a week we spend a few hours going through all our bone marrow transplant patients, coming up with plans with the whole group of doctors. And then I do have to step out early and start seeing patients. So today is my bone marrow transplant day, and I see people going to or after bone marrow transplant, a lot of patients with acute leukemias, some more indolent disorders, and even some classical hematology that needs more urgent referrals. Midday, when I have a few minutes between patients, I run down to the doctor's lounge. They had orange chicken today, which was a fun find, so I eat that while I chart, see patients between bites, and try to catch up on work as much as possible. I'm also on call today for mostly classical heme disorders, but that means I'm getting calls from EDs, other hospitals. Sometimes I do need to travel around the valley to see patients. So these days can get pretty hectic. It's all about triaging, trying to keep from getting too far behind, and just making sure everything gets done and as fast as possible. Got a fun surprise again for Doctor's Week from some of our administrators today. And then back to work. I chart, work on patient stuff until about 5:30 p.m. until I finally can head out. Sometimes this is when I do also have to start traveling around to see more acute consults, but luckily today there was no one that I needed to actually travel around and go see right away. Finally got to head home. My husband had ordered takeout. We don't have a kitchen right now, so it's been a lot of ordering food. Took our boys on a quick walk while it was still light out, and then it was time to sit back down and finish charting. Truly, there are hours every day of charting for every day of clinic. So I did this from about 7:30 p.m. till about 10 p.m. Didn't truly get everything done, but some of it's just going to have to wait until the weekend. Quick bedtime routine, and then it's off to bed. So you can see, often working 12 or more hour days. It really is not a very glamorous job, and it is mostly at a desk.